Thank you very much. So I am going to record this presentation, so hopefully then if anybody needs a copy, they will be able to have a copy of the presentation afterwards. So as you heard, my name is Lesley and I am an occupational therapist based within a university on the south coast of the UK. And I've been asked to do this webinar today on an introduction to snoozling for children with disabilities. So I've included a plan of the session of what we're going to cover. So we're going to look at some of the evidence supporting what we're actually trying to do. So how is this approach affecting the children we're working with? I'm going to cover some information about how we can assess the sensory needs of children with autism. And then I'm going to be looking at some of the ways we can implement this sensory approach within the snoozling environment, looking first of all at a general approach that we can use with our children, but also then looking at a couple of pieces of equipment to talk about how those might be used specifically with children with autism. And then I'm finishing up with some further examples of sensory spaces that you might want to consider for where you actually work. So just to start with, I thought it'd be quite useful just to give a bit of an overview about what we understand by snoozling and a snoozling room. It's one of these concepts that is used very frequently to describe a space, a designated space with specific types of equipment. So if you can see, and I'll just get my laser pen here. As you can see from this picture here, we've got a designated snoozling space, and you can see it consists of your sort of contemporary type of equipment, the bubble tubes, the optic fibres, areas for people to actually relax. But snoozling can be used with lots of different client groups, and consequently, some places will only choose certain pieces of equipment. So if we look at this picture here on the right, you can see this is a care home setting for young people with neurological disability who actually wanted to create a sensory corner, and they've got bubble tubes and optic fibres as their main focus of their room. And the final point I wanted to make is not all places can afford the space for a designated snoozling room. So for example, the picture at the top here is showing another care home for older people with dementia who didn't have the space for their snoozling room, but had portable equipment. So portable sized bubble tubes and switches, using everyday objects within their space as well. So a snoozling room can be anything from this very specific designated space that we can see over here, right to portable types of equipment that you may want to use or maybe take out to a child's home. Now, snoozling has been around for many, many years, about 30 years in total, and it started off being used with adults with learning disabilities. Everyone knew that snoozling tends to be used with children, but that's not true. It did start with adults. So it was used extensively with adults with learning disabilities in Holland, particularly adults with Down syndrome and adults with autism. But soon it became very evident it could be used with other client groups as well. So it was started to be used with older people with dementia, and that's when it came across to the UK. Further on to that, we soon realised that using a sensory space was really helpful for managing some of the anxiety and behavioural problems that we were seeing in acute mental health. So sensory rooms started to spring up in hospitals for people with mental health disorders. Sensory spaces were also installed into palliative care settings and hospices for pain management, because again, if you can get people to relax, it can reduce their perception of pain. And I think that's something just bearing in mind for some of your client groups too, because whilst they might not necessarily be at the end of their lives, pain management can be an issue with children with autism. So knowing that you have an intervention that can actually reduce levels of anxiety and decrease perception of pain is pretty important. We also know of a number of sensory spaces that are being used in maternity units, again for that pain management concept. And there's several hospitals in Australia who use sensory rooms to help their mums who are in labour, managing the pain of labour. And finally, sensory spaces and sensory equipment is also being used with people with extreme neurological conditions. So for example, people emerging from coma, or the severe ends of multiple sclerosis, Huntington's chorea, these severe neurological conditions, as a way to actually stimulate the brain and actually bring people out and increase their awareness as they're recovering from their neurological condition. So essentially what we were discovering is that snoozling had the potential to influence what was going on in the brain. And I think it's important for us to remember that we're not just talking about an activity that is just fun and something just to engage us, but we're talking about an activity that has a therapeutic impact on the people that we're working with. And I think it's worth just touching on some of the neuroanatomy and the way the brain works to understand what we're actually seeing when we're taking children with autism into these particular rooms. As a result of this understanding, various different models have emerged to help us understand why people respond the way they do to different types of sensory input. So I think the important thing to start with is recognizing that the way we interpret our environment is a result of many different nerve endings that exist in the body. So we have our exteroreceptors, which are the systems that we use to interpret information from the environment around us. So those are our sensory systems of sight, sound, touch, taste, and smell. Everybody's really quite aware of those. People tend to focus very heavily on the sight aspect in the sensory room, but in fact it's pretty important that we remember that we use many different senses when we're in a sensory room, including sound and touch, and possibly even taste, and I will touch on that a little bit later. We also have what we call interoceptors. So these are our sensory receptors that are inside the body, and I think one that we're probably quite aware of are things like when we're hungry and we get that feeling of hunger, or if you have stomachache and that feeling of pain. So those sensory systems inside our body respond to the different types of stimulation that's actually going on. Then we've got our proprioceptors. Our proprioceptors are the nerve endings that exist in all our joints and tell us where our bodies are in space. So if I close my eyes and I touch the end of my nose, it's my proprioceptors that are telling me where my limb is in relation to where the end of my nose is, and I'm able to hit the right space. And they are guided by an image that we hold in our brain about where our body is and how far we have to reach to get to different parts of our body. Interestingly, a number of years ago, I lost the end of my fingers in a sailing accident. And I was talking to our occupational therapy students about our proprioceptors. And I said to them, if you close your eyes, your proprioceptors allow you to find the end of your nose. But because in my brain, the image of my body had my fingers at normal length, but actually the reality was that my finger was slightly shorter, I totally missed my nose and poked myself in the eye. So that just shows you how it's this image in your brain that influences where you actually are. And that is very important because for many of our children, understanding where they are in space and where their body is quite difficult, particularly children with autism. And finally, there is our vestibular sense. And these are the structures that are located in our inner ear. So your semicircular canals. And they tell us about gravity, movement, and velocity. They're the thing that tells you actually if you're moving forward. If you get a conflict between, for example, your vestibular system and some of your extra receptors, say your sight, then that can cause a conflict in the brain and can make you feel uncomfortable. A good example of that is those people who get car sick. So when they're in the car, their vestibular system is telling them that they are moving. They have this sense of movement. But actually, if you're sat in the back of a car and you're reading a book, your visual system is telling you you're stationary. So you have a conflict between your inner ear, which is telling you you're moving, and your eyes, which are telling you you're stationary, which can make you feel uncomfortable. And again, many children with autism have this sort of conflict between what information is coming from outside of their body versus what is they're actually being told from the inside of their body. The reason why it's important for us to consider the sensory systems is because these build. So as you can see down here, I've put sensory at the bottom. When we're young, we get lots of sensory input through sight, sound, touch, taste, smell. Our mothers rock us, so that's a little bit of vestibular input. We're put into rooms with brightly coloured toys, visual input. The songs and nursery rhymes we sing to children, auditory input. We build on those sensory systems until the child starts to explore their environment, and then they're starting to get a perceptual concept of where they are in the world. And as a result of that exploration, they start to form judgments about their world, and that is cognition. So that's a normal trajectory that we would expect of a healthy young infant. The thing is, if you have a learning disability, very often it's difficult for you to progress up through these phases, up to this area of cognition. And we, as teachers or therapists or care staff, have to start working on the sensory system in order to slowly work on these higher order skills. So sensory and snoozling fits very well into this lower level. Now, what's basically happening is sensory information is coming in through the systems that I mentioned to you, and the information comes up through the spinal cord, and the information is processed firstly in this area. So we've got the medulla, and we've got the pons, and we've got the midbrain, and these three structures together interpret sensory information. But there's another really interesting structure that exists here, which is called the reticular formation. And I always think of it a little bit like the game control on a computer game. So some people, their reticular information is turned up high and they're on the go, they respond to everything really quickly, they're quite hyper. And then you get other people whose reticular formation is turned down low and they're maybe a little slower to respond, they're thoughtful, they wait on things, wait on information. Neither are right or wrong, they're just the way we're wired. But the thing is, if you do have a child who is very hyperactive, you may want to try and turn down this game control. You may want to lower the level of arousal because they're bouncing around so much, it's quite difficult for them to take in information. And likewise, you may have a child who is quite unresponsive and you might want to turn this system up to make them aware. Now, this reticular formation, which lies the whole length through here, through the medulla, the pons and the midbrain, is influenced by the sensory systems because the sensory systems are processed here in the pons. So we know that if we give lots of high intensity sensory input in, then that's going to turn the gain control up. If we lower the level of intensity, we can turn it down. So the snoozling room is quite good for either stimulating up or actually calming down and getting the right kind of effect. Now, in order to work out where your child is, you actually have to think about the assessments or use some assessment tools to actually help with this process. And I've listed a number of assessments down here, but I'm just going to talk about one or two of these particular assessment tools. The first one I wanted to draw your attention to is the sensory profile. And the nice thing about the sensory profile is that there is a different assessment for the different age points in a person's life. So there is a baby sensory profile for children up to 12 months. And then there is the sensory profile, which is this one here, which is for children going up from 12 months up to 12. And then there is the adolescent and adult profile, which goes from 12, I think it's to 85, I seem to remember. So depending on the age of the client group you're working with, you can pick the assessment tool that suits their particular age span. The children's versions are obviously designed for either a parent or a carer or a teacher to complete. The adolescent and the adult version can either be completed by the individual themselves, or again, it can be completed by a carer. And what this assessment does is it tries to work out whether you're one of these people who has the gain control turned up, or whether you're somebody who has the gain control turned down. Let me explain that a little bit more. So what the profile does is it looks at, as I said, your threshold level. So do you have a low threshold? That means that you don't need much sensory stimulation before you respond. Or do you have a high threshold, which means you need lots of sensory stimulation before you respond? Now, most people, it's not quite as straightforward as that, because some people will have a behavior response according to the amount of sensory information coming at them. So some people, if they're not getting enough stimulation, will actively go out and seek it. They're active. And some people don't. They just wait for it to actually come and affect them. And this particular assessment tool breaks people down into 4 areas. I'm going to start with the area over here. So if you're somebody who has a high threshold, that means you need a lot of sensory input before you respond. And you are active, that is that you go out and you seek that sensory information. If you're not getting enough, you go and get it. Then you're what you're called, you can be classified as being a sensory seeker. And even amongst the normal populations, these criteria apply. So for example, my youngest son, William, is a sensory seeker, and he was always getting told off at school because he just couldn't sit still. He was a fidget. He was always interacting with things when he's supposed to be concentrating on the class. He was always talking to his friends when he was supposed to be listening to the teacher. William hasn't got a problem. He's just a sensory seeker. He needs lots of stimulation to keep himself alert and awake. So what we did with William is we sat William on a gym ball. You know, those big round gym balls that you can get. So we sat William on a gym ball so he could sort of wiggle around on his gym ball, and then he found his concentration improved. So William's a sensory seeker. There are other people who also have a high threshold, meaning they need a lot of stimulation before they respond, who are quite passive. These people are called low registration. This is me. So I'm the kind of person, most people will say I'm very calm, I don't get stressed, I'm easygoing. Well, actually, the reality is I haven't noticed all the stimulation that's going on about me. So I sort of drift through life. Consequently, I sometimes miss stuff. If somebody has a new pair of glasses or has a new haircut, I don't always notice because I'm not being orientated to the stimulation around me. So I need to create artificial stimulation, like my alerts on my telephone to keep me tuned in to what's going on. People with a low threshold don't need much stimulation before they respond. If you're active in managing that stimulation coming at you, you're called a sensory avoider. These kind of people don't like being stimulated too much, so they make sure they create an environment that doesn't stimulate them too much. They like routine, they like order, they like things that they know, so they don't like trying strange food or going to strange countries because they don't quite know what's going to come next. So they spend a lot of time making sure everything around them is ordered and they know what's going to happen. Then you also have people also with that low threshold, so respond very quickly, but don't actually quite manage it. And as a result of that, they can get overwhelmed very quickly. This is the criteria you often find that children with autism fall within, because they find it quite difficult to modify and actually control sensory stimulation around them, and they can find it overwhelming. You sometimes find that people with autism will do things such as wear headphones when they go outside so that they can manage the amount of noise that is coming at them. And if you've got the ability, you can create those kind of solutions. But for many of our children, they find it very difficult to manage the sensory information coming at them. Another thing we need to consider is where our sensory preferences lie. Now, all of you will have a sensory preference. Some of us are more drawn to visual stimulation or auditory stimulation, or maybe touch. And this particular assessment asks a number of different questions that either the individual can complete or a carer can complete for them. And it will ask a question, and as you can see from the image here, we have this question, which is around sight, is drawn to brightly coloured objects in the environment. And then we say, does it never happen? Does it rarely happen? Does it occasionally happen? Does it frequently happen? Or does it happen all the time? And there's a little button here that if you click, it gives you an example of what we mean by this. So you complete 10 questions for each of the sensory areas, and it gives you a frequency chart of how people orientate to particular sensory areas. So again, you would be able to find out whether your child is more drawn to auditory information or movement information. We can also do this by observing children in their normal environment and actually looking to see which activities they gravitate to the most. Now, you may find that your child is orientating to movement, which on one level is good, but it could be that they're not orientating to these other areas. So we may choose to set up our sensory room or our snoozling room to include elements of these other areas that are not being stimulated by the general activities the child's taking part in. Another assessment which is of use if your children are going to school is the sensory processing measure. And again, this particular assessment looks at how sensory processing impacts on the child's schooling ability. And this other assessment, the sensory modulation assessment, again looks at how much stimulation somebody wants. This assessment works really well with perhaps more teenagers, and it uses the concept of your engine motor. So it asks the question about how does your motor run? Are you revved up, or actually are you going slow? And it gets the child to rate on a daily basis how their engine is running and what things actually help their engine calm down, or what speeds the engine up. It's a useful tool because parents can often work out which activities for the child turn its engine up or calm it down. And that can be made into a game as well for children. And finally, the pool activity level, which is a very useful tool for helping you to structure how to run a snoozling session. And it's a simple assessment, and at the end of it, it will tell you where the individual sits on a criteria. So somebody who sits at the planned level is able to complete activities and search for objects, follow simple instructions, and use memory prompts. Somebody who's at the exploratory level, which is the next level down, can complete familiar tasks and knows what the outcome of that task is, but might need the activity broken down into its individual steps in order to complete it. Somebody at the sensory level, which is often the area that many of our children are actually operating at, they may not understand the purpose of the task. They're more concerned with the sensation, how it's feeling. So consequently, you have to break your steps down one at a time. Also, they respond to verbal and non-verbal communication. So we have to have both when we're communicating. And the final lowest level is the planned level. And this would be for individuals who perhaps are very poorly, maybe palliative care, very unresponsive. And this individual doesn't particularly have awareness of the environment. And actually movement is in response to a stimulus. When this is the case, we can only ever stimulate one sensation at a time. So you go in with your sensory approach using vision, and then you'd stop that one. And then you'd come back and you would use maybe auditory, and then you come back. So you'd only stimulate one sense at a time. And all the communication with that individual is going to be non-verbal. So just to give you an example of what that might look like, I have just put a slide up which is looking at how the PAL guides activity. So this is a session for a child with autism, and we're looking at the sensory level of the PAL. And the guidance says that you need to position the objects in the direct eye line. So you've either got to place the child or the object in direct line, because if you have other objects around them, then the child might orientate to those other objects. It also suggests that you focus on one sense at a time. And in many ways, that might feel strange because a lot of people will switch on every piece of equipment in the snoozling room. And I would suggest don't do that. Switch one piece on at a time, because then that'll help that child focus on one sense at a time. When you bring the child into the room, you need to let them have time to settle. So time to maybe explore around the room. You might need to guide their movement. So that might be hand over hand to get them to orientate to the bubble tube or the optic fibers. And you would reinforce what's happening with your verbal and non-verbal cues. So hand over hand, round the bubble tube. Oh, can you feel the vibration? Can you see the bubbles? So you're reinforcing the sensory experience. The directions, one step at a time. So I gave you an example there. Can you see the bubbles? So you would give one instruction and then you'd give the child time to respond. I think one thing we're all very guilty of is often we give instructions, too many instructions. So we might say, can you see the bubbles? And we add something on, and suddenly you're asking the child to do two things at once. It also talks about the length of time to focus. The average person can only concentrate for 20 minutes. For our children, that concentration time is often a lot less. So this guidance is saying no longer than 10 minutes at best, allowing the child to focus in on the sensation you want them to experience, and then possibly giving them some time out or a break from that before going back in and focusing on another sensory area. I've also suggested it needs to be one-to-one, because again, for our children, they may find it difficult to focus if there's other children in the room or if there's other therapy sessions going on in the room. And finally, we would end the session by gradually increasing the light so that they can orientate back to the environment they're going back out to. And the reason we're doing that, as many of you might know, if you're in a sensory room or a snoozling room and it's dark and it feels very cozy, to suddenly walk out to the general environment again can actually feel quite shocking. Our overall objective of our session is to arouse conscious awareness of the child's self and their immediate environment, working on those sensory components that were part of that pyramid that I showed you at the beginning of this session. So what about running a sensory session? I think the most important thing to consider is that snoozling is basically a toolbox. You can't switch everything on in a snoozling room and take a child in there and leave them there for 20 minutes and hope something will happen, because that won't give a therapeutic effect. You do need to think carefully about what the needs are of the child, and then you need to set the session up to suit that particular child. So our toolbox should have something in it for stimulating sight, so visual stimulation, sound, both volume of sound, so loud and soft, but also the use of things such as bass, which can give quite a relaxing kind of effect. We need to think about items in the room that give you different levels of stimulation with touch. I mentioned taste earlier. It could be that you might want to introduce some taste stimulation. What we do know is that the area around the mouth is highly sensitive, and there are many nerve endings around here. So stimulation with some substances can increase arousal. So for example, citrus fruits tend to be stimulating. Anything that involves sucking, gives you that deep pressure in the mouth, will actually calm you down. Smell, again, citrusy kind of smells will be stimulating. Flowery kind of smells are relaxing. Movement, both vestibular and proprioceptive, and we'll talk about some of these a little later. But then we also need to think about the intensity. So how intense is the stimulation? Is it really, really bright? We need to think about how long we're going to stimulate for. We might want to think about consistency. So for example, a wall panel, the infinity panel, can be speeded up or slowed down, and you can get changing and variations of pattern, which is actually highly stimulating for the brain. Or would you prefer something that just keeps the same regular rhythmic pattern going round, which gives you some more consistency? Be aware of competing stimuli, and like I said to you, that might be other people in the room or other therapists. And also think about introducing items that are familiar to the child. So they may have a favorite teddy bear or toy that they want to take in, which will actually help them focus and engage. Think about your level of arousal. Are we trying to stimulate or are we trying to relax? And think about how these different pieces of equipment can be used in different ways to make it fun. And we'll talk some more about that in a second. So let's break this equipment down into how to stimulate and how to relax. So on the left-hand side, we're going to have our sensory systems. And over the top, we've got stimulating, we've got relaxing, and then I've given some examples of the equipment. So what we do know is for all of our sensory systems, anything that is unpredictable, unfamiliar, or cannot be anticipated is going to be stimulating. And that will be the same for you. If I drop you in an unfamiliar country with unfamiliar smells, and you don't know what's coming next, you will be hyper alert. Whereas anything that is predictable or familiar that you can anticipate will be relaxing. So if I then take you back to your own homes, you walk in, you know where stuff is, you know what it smells like, it's very predictable, so you'll be more relaxed. So we can set up our multisensory space to be either stimulating or relaxing. So let's think about touch. Anything that has a light touch or is sharp, so just thinking about the end of the optic fibers, for example, or anything that is hot or cold, so maybe the waterbed, is going to be stimulating. Whereas anything that gives you that deep pressure or long deep pressure, large body contact is going to be relaxing. So thinking about some of the massage mats that you can put around your shoulder, or the massage cushion, that is deep pressure and it covers a big area of the body. So that is relaxing. Other items that fall within this are things like the weighted blankets that you can use, or it could be something, an everyday item like a hot water bottle. And we've got The vestibular system, that's the inner ear telling you about movement. What we know is random head movement actually is stimulating, which is why when you go on a roundabout or a fairground ride, that can make you feel very stimulated. It's turned again control up. Whereas linear head movement, so rocking or bouncing, remember I said putting William on the gym ball will actually be relaxing, which is why we rock babies, because it has that linear action. So items that we might use, obviously with older adults, we might use a rocking chair. For children, we can get rocking animals. But you may actually just use switching systems, so getting children to actually reach in the midline or maybe randomly reach at different directions will increase level of stimulation. Proprioceptive system, so that's where our bodies are in space. Anything that is brisk and quick movements is going to be stimulating. So you know, if you're dancing around the kitchen, lots of random movements, that will stimulate. Anything that gives you long stretch is going to be relaxing. Thinking of things like yoga, where you're doing those long sustained positions, or maybe lifting something or emptying the washing machine, that pulling the clothes out the washing machine gives you long, heavy actions. Those can be relaxing. Equipment we might use, a lot of the wall panels have various different games attached to them. Some of them are very simple games where children have to match colours, and there are other panels with much more complex games on them, and they are used to actually increase proprioceptive awareness, because you've got to know where to go on the panel with your body. Visual system, anything that is very bright or even flashing. I'm sure most of you will have been into nightclubs and discotheques in your youth, will know that are very stimulating. Whereas low-level lighting or constant lighting, the kind of lighting you have in your own home, for example, tends to be relaxing. We can get this level of stimulation either through the fibre optics or maybe the spotlights or the bubble tube. Auditory system, anything that is variable, so the tune goes all over the place or very loud, is going to be stimulating. Again, thinking of your nightclubs. Whereas music that is soft and quite long, so thinking like classical type music, which tends to go on for maybe for about 5 minutes, tends to be more relaxing. Think about the music that you will use in your snoozling room. It doesn't have to be new age music. If it's young children, they may have a choice of music they prefer. That might be nursery rhymes or a particular pop group that they might like. And then finally, for taste and smell, anything that has a strong intensity like mint, either mint that you eat, mints, or even citrusy fruits, lemon, orange, will be stimulating. Whereas mild intensity, like chocolate, tends to be more relaxing. Oops. So let me just give you an example of a couple of pieces of equipment using some of these principles. So if we think about the bubble tube, I chose this one because I thought most people would be familiar with this. I've already given some suggestions. You can get the child to put their hands around the bubble tube. You might have your hands over the child's hands to help them control it. Vibrations they can feel. Possibly get them to track the bubbles up and down the bubble tube and following it. You might even want to put plastic fish in your bubble tube and getting the children to spot the fish, either by pointing at it, and that's stimulating that random proprioceptive movement. That also stimulates sight. So obviously fish and tracking the bubbles is going to be a visual activity for the child as well. And another aspect that children quite like is being able to put your head up against the tube and listening to the vibrations. That has a very slow, deep vibration, which can have a relaxing effect on the child. Other things that you can do is that you can attach switching systems to the bubble tube, and maybe getting individuals to recognize cause and effect. So if you press the red button, the tube goes red, or if you press the yellow button, it goes yellow, or even numbers. So pressing number 1 makes it go one color, or pressing number 2 stops the bubbles completely. So you can use it for teaching skills as well as learning cause and effect. And the other aspect you can use is if you're trying to create a general relaxing feel, the bubble tube can be a focus in the room. So if you switch everything else off and just have the bubble tube on, then it can have a very calming, very relaxing kind of feel. And the other thing you can do, which is a bit more stimulating, is set up a game with the big coloured dice. So the child throws the dice, and if it comes up yellow, then they get to press the switching system on the bubble tube to yellow. So children can play a game, and they start to develop the concept of sharing and interaction, and again, cause and effect. So thinking about the optic fibres, again, for stimulation, there's lots of things you can do in terms of touch. So feeling the strands, getting the child to actually run their fingers through the strands, a little bit like running your hands through hair, or even draping the strands over your body and sort of looking through it. It creates a different perspective on the world. The other thing that you can do is, as you can see with this little boy here, we've got a fistful of optic fibres, and you can get the child to move them around. If you move them quickly and create big movements, you also get a bit of a visual effect. So it's like, you know, with the sparkler during fireworks, if you move a sparkler around, you get the lines. You get a similar kind of effect with the optic fibre if you move it very rapidly. And again, getting children to create shapes or even write their name using the optic fibres can create both a visual and a movement orientated sensation. And on top of that, you can create those games. I mentioned about putting the optic fibres over you, and it might be that you're actually crawling through a tunnel and trying to get out the other side, or you're exploring a big pond looking for a secret treasure as you pull the optic fibres aside, looking for an object that's actually within there. One other thing you can do, if you've got a child who doesn't like the open space, is you can just get a box, an ordinary cardboard box, and you can cut a hole on one side, like a tunnel hole, and then the child can lie in there and look up, and you can poke the optic fibres in through the roof of the cardboard box. So that restricts the stimulation or distraction of other objects around the child, and they can start to pull them through as well if they want. So that can be quite a nice effect. And the final thing that I've included in here is the ball pool, really for something around tactile. Ball pools have been used both inside and outside of snoozling rooms. They're often used in rooms that have a much more active kind of focus, as you can see from this picture here. So with this, you can actually give people different textured balls to feel. So traditionally, ball pools have always held the round plastic balls, as you can see here. But you can also get different textured balls, and certainly I know Romper do a whole range of balls that you could include into your ball pool. And in fact, within that, with the sight bit, you could get then the children hunting out different coloured balls within there, not only the unusually textured balls, but also maybe collecting all the yellow balls or collecting the blue balls. Another one based around this sort of treasure hunt concept is including the balls with the bells in them, so that actually it's not until you move the balls and you can hear a bell rattling that you know where to go and seek the ball out. The other thing you can do, jumping back up to movement, is sort of swimming in bull pools or creating different kind of body shapes, again giving that proprioceptive and vestibular input. So what other kind of snoozling rooms are we aware of? This is the more conventional one that you've seen before. So this one is your conventional room with optic fibres and bubble tubes, mirrors at the back to create the sense that there's more bubble tubes there. So it looks like a forest of bubble tubes. This one is a picture of a de-escalation room. So this is where we're trying to turn the game control down and reduce the level of stimulation, giving one sensory input to stimulate, but only very gently. So they're using visual stimulation here with an image on the ceiling, but maybe just something with one bubble tube would be another example of a room that would calm that game control down, that de-escalation. We can have snoozlings that are around water. So this is a jacuzzi with optic fibres, and those optic fibres can actually be draped into the pool. As long as the electrical source is outside of the room, you can get the optic fibres into the pool. And what happens when you switch on the bubble, the jacuzzi effect, is all the optic fibres move in the water. And again, that's very good if you're trying to get a child to stretch and reach, maybe to seek or to interact. We use this particular jacuzzi is based in a day centre for adults with learning disabilities, and we use this a lot with some of the individuals who came in with wheelchairs with contractions to try and actually get them to stretch out and reach. You can have outdoor snoozlings. So this is an example of a sensory garden space using water, different textures with stones and wood, and also activities that really focus on that sort of cause and effect. And again, this is very popular with children in encouraging exploration. This is a room that they've had to double up. So they couldn't have a purpose-built snoozling room. They had a space, but they had to use it for other things as well. So as you can see, this is a room that can be used as a snoozling, but it could be also used as a family room or a relaxation space. So you can adapt your spaces to accommodate different needs. This is a sensory approach in a bathroom in somebody's house. So this is somebody who has a teenager with autism, and they've put in a ball, a mirror ball here. So the mirror ball sends all these little dots around the room and creates a very relaxing kind of effect. And there's a projector here projecting onto this wall. And it was a way of helping this teenager relax when they were trying to help him bath. Oops. And just some other examples of sensory spaces, but this time with some of the wall panels that I mentioned where you can do cause and effect. And then my final shot is the idea that you can have portable sensory spaces. So here we have, again, one in a child's bedroom where they've bought a little corner unit and installed, but they've used everyday items as well to make it feel familiar for the child. Or this is a pack that you could buy if you wanted a portable kit, which will cover elements of sight, sound, touch, taste, and smell. And again, here's my version that was in the care home using a few portable objects that could be taken to different individuals' rooms to set up a sensory space. And the final thing I wanted to mention is this particular guidebook, which I wrote with an architect. It does say for people living with dementia, but it has got some good ideas if you're looking for solutions to help people adapt their homes